All right, Lakin, thanks so much. And to continue our discussion about the coronavirus and its potential impact on you, we have Dr. Casey Rice, who works in infectious diseases at Mercy Medical Center, joining us now. And Doctor, thanks so much. As soon as people hear the word coronavirus and they see that it's being diagnosed in Iowa, you probably see how people react with, obviously, fear, right?
Absolutely. With seeing coronavirus in the news every single day and these images of people that are frightened and wearing masks, and one might assume that the coronavirus that they have been exposed to could be this international strain, this COVID-19. But as you've just heard, there are many strains of coronavirus that already circulate year after year throughout Iowa and other states that typically cause milder disease. They can cause colds. Like most coronaviruses, they can cause more severe disease if you have underlying medical conditions, such as emphysema, COPD, heart disease, those sorts of things.
Are you guys, in your practice, diagnosing one of the strains of coronavirus very frequently in Iowa?
No, we're not. Every once in a while, if we have a patient that's been hospitalized with a severe respiratory infection, we will test for a number of viruses. We have a panel that can look for various causes of respiratory infection, and once in a while coronavirus comes up. As with the current COVID-19, most coronaviruses, actually coronaviruses in general, do not really have a antiviral treatment. We give supportive care, and luckily in most cases do very well, and people recover with supportive care.
Okay, and with regard to COVID-19, the actually deadly coronavirus that's active in, mostly in China, what do you think about the direction that this is going to take and doctors' abilities to slow it down or stop it?
Sure. I mean, that's asking for some forecasting, but we certainly do not want the virus to continue to spread to other countries. Many countries already are seeing cases, including, as you mentioned, Southeast Asia, China, Japan, the Philippines. It's spread to numerous European countries and the U.S. Now, I should point out that most cases in the rest of the world are from patients returning from China who have traveled to China. There's not a lot of spread in other countries. We've had 13 cases in the U.S., as you mentioned. 11 of those were returning travelers from China, and the 2 other cases were the spouses of returning travelers. So we really aren't seeing any significant transmission within the United States yet at this time.
And Iowans, in your opinion, don't have to change anything they're doing right now?
Well, I think it's a good reminder. There are viruses circulating every year, including influenza and other viruses that are also are dangerous. And it's a reminder that we should practice good preventive measures, like hand hygiene is probably the most important one. Washing your hands frequently or using alcohol gel. The risk to Iowans of COVID-19 really is not there at this point.
All right. Dr. Casey Rice from Mercy Medical Center, thanks so much for joining us today.
My pleasure. Thank you.